Good afternoon, everyone. I just got off the phone with fellow governors and White House officials, and here's what we heard. The CDC director, Dr. Walensky, started by discussing booster shots. The FDA Advisory Committee will be meeting on Friday to discuss the Pfizer shot for boosters. Moderna and J&J are expected at a later date. Then the full FDA will take the Advisory Committee recommendation before CDC issues its formal recommendations on boosters. They are currently working to manage their inventory in anticipation of increased demand if the Pfizer booster is approved. The FDA and CDC are currently doing studies on mixing and matching vaccines from different manufacturers and hope to have recommendations on that as well very soon. Secretary Smith will talk more about our preparations here in Vermont for boosters. Next, as I announced last week, effective tomorrow, all our executive branch state employees will have to attest that they've been vaccinated or be tested weekly and wear a mask. We think this will make workplaces safer, and as we await more details about President Biden's executive orders, in the meantime, I continue to urge other employers to adopt similar policies as I have for weeks. As part of the President's plan, he's encouraging vaccines for school employees like we've done for state employees. Because we aren't under a state of emergency, the state doesn't have the authority to implement such a mandate ourselves, but I urge school districts, who are the employers, to use the state as a model and take a similar approach. I've also asked the Commissioner of Labor to clarify whether school employees are covered under the OSHA rule being contemplated as employers with over 100 employees. Considering these steps is important because, once again, we know that vaccines work. Vermont is the most vaccinated state in the Union, and we continue to have the lowest hospitalization rate. Today, currently, there are now 43 Vermonters hospitalized with COVID-19. 36 of them are unvaccinated. Just 7 are fully vaccinated. So please, get vaccinated. They save lives. Finally, September, we recognize Suicide Prevention Awareness Month in Vermont and across the country. Secretary Smith and Mental Health Deputy Commissioner Allison Cromp will go into further detail about the work we're doing and resources available to people, but I wanted to share some information as well. Suicide, unfortunately, is the 8th leading cause of death among Vermonters. There's no denying the stresses of living through COVID-19 have increased many of the risk factors associated with suicide, including depression, social isolation, financial stress, unemployment, and challenges to mental health. Vermonters have shown our resiliency and support for our communities throughout the pandemic. Every suicide in Vermont has a terrible impact, and we must each do what we can to prevent these losses. It's important we address the needs of family members, friends, and neighbors who may be at a higher risk, including those who live in rural areas, as well as older Vermonters and those who identify as LGBTQ+ and BIPOC. It's also important we recognize those who work on the front lines of suicide prevention, our local educators, mental health professionals, first responders, parents, friends, and more. By joining those around the globe in recognizing World Suicide Prevention Awareness Month, it's a reminder of all the actions we can take to help those in need. There are many resources and support services available. You can go to vtspc.org and learn more about awareness and how to talk to someone you think may be at risk. Ask if they're okay and offer to help. I encourage Vermonters to come together, support each other and the people in your lives who may be struggling. You may be just the lifeline they need. Again, Secretary Smith and Deputy Commissioner Crump will go into further detail in a few minutes, but first we'll turn it over to Commissioner Picha.
Thank you very much, Governor, and good afternoon, everybody. Similar to the last few weeks, when we look through our data today, we'll see signs that point to optimistic trends, but we also see signs that point to some cautionary trends as well. So I want us to keep both of those items in mind as we work through the presentation. To start with, when we look at the national data, you can see that the 7-day case rate after Labor Day continued to trend down. For the past 7 days, it's down about 10%. But also be mindful that we're still waiting to see if there are any impact from Labor Day, and there's also still some data anomalies with the national data because of reporting delays in other states. So again, the trend is looking good, but we want to be mindful of that. On the next slide, you'll see the growth rate that we've been talking about for the last probably 5 or 6 weeks. The growth rate had slowed week over week. And finally, this week, you can see it's gotten into the negative. So the growth rate across the country has declined below zero, meaning cases are actually falling, not just that the rate of growth is decreasing, which is certainly, again, a good sign and something that points toward some signs of optimism. Another sign of optimism is the national hospitalization rates that you see on the next slide. So unlike the data that can sometimes be, jumpy on the case side, particularly after a holiday or some other event where cases aren't reported, hospitalizations continue to be reported through those weekends and through those days. And again, you can see here that the hospitalization rate has ticked down nationally in the country. Again, another good sign. Again, when we look at the national picture and we look at where the cases have been decreasing week over week, we see that those places in the southern part of the country that were hit the hardest, earliest with the Delta wave are the ones that are seeing the improvement. When we look up to the northeast, you see that Vermont is down a bit from last week, same with Connecticut, but it's not a universal story across New England or the region. We certainly would like to see the region, New England states in particular, all trending down, moving in the same direction, and we're not quite there yet. So Vermont has seen improvement, another New England state, Connecticut has, but that's only a piece of the regional puzzle. Talking about Vermont, as we mentioned, again, we've been talking a lot about that growth rate. You see here that the growth rate did continue to decline. And again, like we said here in Vermont, it went below zero, meaning our cases decreased over the last week compared to the week before. You can see that on our 7-day average when we go to the next slide. We've reported about 86 fewer cases this week than we did last week. But again, when you look at that 7-day average, the trend is down, but it's not a clear trend down and it hasn't been sustained yet. So that's the point of caution, certainly, that we want to take into account. Looking at where the cases are across Vermont, on the next slide, you'll see that Washington County has seen some improvement. That was a county that was particularly high last week. Chittenden County, a little bit higher than last week, but still relatively stable. The Northeast Kingdom has seen some increased case counts, particularly in Orleans and Essex County. In the southern part of the county, relatively stable, although a bit higher than it has been in the past number of weeks. Looking at the age groupings, and particularly focused on younger Vermonters, since there's been a lot of discussion, certainly in the national media, about case rates among younger Americans. We can see that in Vermont, those age groups that are below those that are able to be eligible for vaccination are higher on a per capita basis than the total Vermont rate. You'll see that that 15 to 18-year-old age group is lower than the national average. They're eligible for vaccination. They have a really good vaccination rate relative certainly to the rest of the country and even other age groups in Vermont. But you do see some elevated case counts there in the younger Vermonters. But again, we've been fortunate. I think today there's one pediatric hospitalization, but generally these cases have not resulted in hospitalization, which is something we're certainly fortunate about. Looking at the next slide, again, a couple of more trend slides that show that the reproduction rate is still below zero. Again, when it's below zero, you anticipate cases will be dropping. We did see that this week. It continues to be below zero. We hope that that will continue, but again, just a note of caution there. And then finally, looking at the case model, we see that the model that we had from 2 weeks ago, we overlaid the actual case growth onto that, and it's relatively similar, and it's anticipating really this week, the next week, and the week after that cases would start to decline a little bit more significantly. So again, a point of optimism there, but we want to see that unfold in reality, and we want to keep a really close eye on it. Another trend that we've been seeing this week that's pretty clear is the difference between those who are not fully vaccinated and those who are fully vaccinated. So first, looking at the case rates and the difference that we see there. You can see that the unvaccinated or the not fully vaccinated case rate continues to go up. It's up about 7% this week. But the vaccinated case rate, those that are fully vaccinated, that rate actually declined 2% this week. So overall, we saw a decline because we have more people fully vaccinated in Vermont, but that unvaccinated case rate is continuing to go up. So again, all the more reason for people to go and get vaccinated, get their family and friends vaccinated. And again, just as important, when you look at the hospital case slide, you see that the hospitalization rates are much higher for those who are not fully vaccinated compared to those who are fully vaccinated. And on the next slide, as the governor mentioned in his opening remarks, you'll see that that difference has been really kind of exacerbated this week, with 71% of all recent hospitalizations being among the unvaccinated. And when you look at the ICU hospitalizations, the numbers are even greater, with 79% of all recent hospitalizations being among the unvaccinated. So the unvaccinated case rate, the unvaccinated hospitalization rates are going up. Again, they're not, the hospitalization rates are not going up because of those who are not yet eligible. It's really that eligible population that has not yet gotten vaccinated that's driving those hospitalization rates. So again, all the more reason to go out and get vaccinated. Looking at our higher education update, you'll see that now all 16 of the higher ed universities and colleges are reporting. The vaccination rate at the moment stands at 93.6%, so a really high vaccination rate. You'll see that the exemption number stands at just under 2.5%. There's a few hundred students that are still in that to be determined category, but that vaccination rate across campus, very strong. And you'll see the weekly positives and case numbers there. If we go on the next slide, you'll see a comparison of the fall 2020, the spring 2021, and then the fall 2021, the first 3 weeks that the higher education was on campus. And you can see, obviously in the fall of 2020, when cases were very, very low, the vaccine wasn't available to us yet, but college campuses were quite quiet during the first 3 weeks. During the spring semester, cases were much more elevated after coming off of the holidays, that winter surge that we saw. Again, the vaccine not yet available, and the cases were much more elevated. The first 3 weeks so far of school, the cases much lower than we experienced in the spring of 2021. Again, a big difference being that really high vaccination rate that we're seeing across campuses. So far, continues to be pretty quiet on the higher education campuses. Looking at the active outbreak slide for long-term care facilities, the same number of outbreaks as last week, which we reported being 7. The number of cases up a little bit, 134, compared to just about 100 cases last week in long-term care facilities. And then finally, turning to vaccination, you'll see that Vermont added another 2,243 individuals to the vaccination rolls this week. That moves us up to 87% of those who are eligible who have gotten vaccinated. But when you look at the next slide, we haven't looked at this slide for a while, but you really see 2 age groups that stand out in terms of their low vaccination rate in Vermont. That 18 to 21-year-old rate and that 22 to 29-year-old rate, which are about 54% and 66% respectively. So again, particularly those younger Vermonters, really need them to step up and get vaccinated. For those who are their parents, their uncles, aunts, friends, to encourage them to get vaccinated, because they're really a key piece of the puzzle here that we're currently missing. And then when we look at our vaccination rates overall, you see that Vermont continues to be number 1 in most categories, particularly fully vaccinated, which is certainly with the Delta variant is critical. And then we continue to be number 3 on those starting vaccination who are eligible. But again, on most of those categories, continuing to be number 1 in the country. So at this time, I'd like to turn it over, I believe, to Secretary French.
Thank you, Commissioner Pichek. Good afternoon. Later today, Dr. Levine and I intend to issue revised recommendations for the contact tracing process in schools. I thought I would highlight some of the changes that we're including in our new recommendations. Contact tracing is an important strategy to ensure the safety of our communities and our schools. The Delta variant has put pressure on the contact tracing process because it spreads more quickly than other variants, however. In our revised recommendations, we are not making any changes to the standards for contact tracing, but rather we're trying to make the contact tracing process more responsive to the dynamics of the Delta variant. In short, we want to make it easier for both schools and contact tracers to implement the science behind contact tracing. Central to our changes is enabling schools to move more quickly to identify students who are vaccinated. A student who is vaccinated and asymptomatic is not a close contact under CDC or Vermont guidelines. Previously, schools had to wait for vaccination status to be confirmed by the health department. We are now going to enable schools to use their local vaccination information to make this determination. We published recommendations for how schools should determine the vaccination status of students. Schools should use our template form that asks parents to attest to the vaccination status of their children and to show a copy of the student's vaccination card or record. We are also providing recommendations for common areas such as cafeterias, school buses, and playgrounds. Whole lunchrooms should not be automatically quarantined. A risk assessment should be performed to determine a student's physical proximity to a suspected case. Anyone within 6 feet of an infectious person for 15 minutes or more is considered a close contact. This kind of risk assessment can be challenging to implement in the dynamics of a busy school lunchroom. So we are recommending seating charts and, when possible, having classes eat together. Many schools will continue to use other spaces for student meals, such as classrooms, in addition to cafeterias. For school buses, we are recommending whole buses of students should not be automatically quarantined. A risk assessment should be performed that considers the physical proximity to a case on a bus and to what extent there was consistency in mask wearing while riding. The CDC requires masks for all passengers on school buses. In terms of playgrounds and recess, we are following a similar approach and do not recommend automatically quarantining all students on playgrounds, since the risks to students outside are far less than those when they are inside. A school should notify families of a potential exposure during recess or outdoor time and make testing recommendations for 3 to 5 days after the potential exposure, but not put students in quarantine unless they are identified as a close contact. A template letter for handling these types of potential exposures will be available for schools on the Health Department's Pre-K through 12 schools website. The recommendation to test rather than quarantine is a central feature of our revised recommendations. When a student is not a close contact and their exposure status is uncertain, we are recommending testing as the first strategy rather than quarantining. All schools have the ability to sign up for surveillance testing. This testing is free of charge and available for students and staff regardless of vaccination status. I would like to see all our schools involved in surveillance testing this fall. Surveillance testing was an important strategy for us last year. It will be very important for us this year as well, particularly as we head into the winter months. In terms of keeping our schools safe from COVID-19, vaccination is our priority strategy. It will be increasingly important to ensure all students are vaccinated, and I certainly strongly encourage all parents to get their children vaccinated. Vaccination will not only keep our schools safe, but also allow us to continually operate in-person instruction, since it greatly contributes to the efficiency of the contact tracing process. In terms of vaccination, I thought I would provide some specifics on the student vaccination incentive program that we're working on. The intent of this program is to leverage federal COVID-19 relief funds to incentivize student vaccination and to provide opportunities for students to direct the use of these dollars. The grants will go to schools, not directly to the students. The governor has committed up to $2 million in federal funds to encourage student vaccination. $1 million would come from the CRF funds and $1 million from the state set-aside of ESSER funding. All schools will be eligible for a one-time grant award, a bonus award, and the governor's cup. Amounts will be based on total school enrollment and vaccination rates above 80%. At 80%, schools may rescind their mask mandate for eligible students. Students under 12, however, would still be required to wear masks. When a school has a vaccination rate of at least 85%, it would become eligible for a grant award based on $12 per student, with a minimum award of $2,000 and a maximum award of $10,000. A school with a student vaccination rate of at least 90% would also be eligible for a bonus award that would be 50% of the first grant award. Once eligible for the grant program, a school must submit a grant proposal to spend its incentive award. Grant proposals must be developed through significant input of the student body. When the school obtains a student vaccination rate greater than 95%, the school will be entered into the Governor's Cup Award. 3 random drawings will be conducted among these eligible schools, one for small schools, one for medium schools, and one for large schools. The winners of these drawings will receive an additional $10,000 award. We'll have more details on this program in the coming weeks. Lastly, we're starting to work on our approach to winter sports. I strongly encourage all our student athletes to get vaccinated prior to the winter season. Also encourage our athletes in particular to participate in the surveillance testing that will be offered in many of our schools. We intend to publish our recommendations for winter sports in early October at this point. That concludes my update. I'll now turn it over to Secretary Smith.
Thank you, Secretary French. Good afternoon, everyone. I want to provide updates on a couple of topics this week. It'll be a little bit of change of format than we're normally used to. So let's begin with testing. Vermont has maintained its testing infrastructure that was built up over the pandemic. We established 33 state testing sites throughout the state, and we kept that infrastructure in place. Pharmacies in the state provide an additional 21 sites. In fact, this is the reason that, according to the CDC, Vermont is consistently in the top 5 in the nation for testing its residents. Over the last 7 days, according to the Health Department, Vermont performed approximately 36,000 tests. In addition, we monitor lab turnaround times. For example, tests performed between August 29th and September 4th, the latest information we have, shows an average turnaround time of 1.6 days, or a median of 2 days. In the past day, we've heard of delays which we are looking into, perhaps caused by data entry issues with walk-ins. Where we find that there are delays or not enough testing, we will add capacity. Adding capacity may include expanding existing sites, adding new sites, or looking at other options like self-service test kits. We also need Vermonters to help make things run more smoothly. One of the biggest differences between now and last fall is that when demand was low, we shifted from appointments only to allowing walk-ins. Now we are transitioning back to appointments because just showing up in a higher demand environment causes people to wait. I mentioned this last week. Please make an appointment for testing and try to avoid just walking in at a test site without a reservation. You can make a reservation easily by going online at healthvermont.gov/COVID-19/testing or visiting your pharmacy's website. In addition, we're gearing up for testing for those state employees who are not vaccinated. We'll have more to report on that in the coming days. We also have, as Secretary French has talked about, working closely with schools to expand weekly surveillance testing to students. Many districts expressed an interest in participating in this new program. By the end of September, more than 101 schools will have testing programs up and running. That represents more than 37% of school districts, with an additional 50 schools slated to start by mid-October, or more than 52% of school districts. We are working closely with schools to determine what's needed to support them in overcoming barriers to get tested, or to getting started earlier, or encouraging other schools who have not yet signed up to participate. That said, we're excited to see the success they are having in getting students back to full-time in-person learning this fall. Now, turning to our correctional facilities. As for COVID testing at Northern State Correctional Facility, they have had 2 consecutive rounds of all negative test results for both staff and incarcerated individuals. The facility has returned to modified operations, though there will be another round of testing next week before the facility is fully cleared of all outbreak protocol. Outside visitation is open at Chittenden Regional Correctional Facility and Marble Valley Regional Correctional Facility. The other 4 facilities either have COVID-positive cases or in some phase of follow-up COVID mitigation. In order for these facilities to open to outside visitation, there needs to be 0 COVID-positive staff and incarcerated individuals. In terms of reporting case counts, there are times when we have to revise previous days' numbers. We strive to publish the most up-to-date and accurate information on the number of positive cases as quickly as possible. We've also implemented some changes in our technology and added personnel to lessen this occurrence. We will consider additional changes if needed, but the bottom line is we need to do a better job. I also want to mention contact tracing because we've added even more resources lately in this area. In the spring, to allow some in our state workforce to return to their normal jobs, we augmented contact tracing by hiring a contractor. The contract calls for them to increase their workforce as COVID-19 positive case counts increased. Recently, they failed to do that sufficiently, leaving the state to fill the gap. So as of today, we have increased our overall numbers in this area to 104 full-time equivalent employees performing contact tracing, including reaching out to those close contacts and performing other associated duties such as reaching out to businesses and schools. We will continue to add state workers, our National Guard service members, and additional contracted employees as needed. Also, as I said last week, we've been planning for the rollout of the booster doses once the federal government authorizes them. We anticipate that the first people eligible to get booster doses will be healthcare workers and those who work and live in long-term care facilities. The goal is to have a fast and efficient way for individuals in long-term care facilities to get vaccinated. We already have spoken with our licensed long-term care facilities in the state to ensure that planning is underway for boosters. We have spoken with all skilled nursing facilities in the state. All of these facilities in Vermont have reported that they have access to a vaccine partner. After this first group, we'll turn to providing booster doses to the general population. At that point, Vermonters should expect to start hearing about larger vaccination sites. When we get to this phase, you will need to make an appointment to get a booster. However, we are not currently taking appointments for booster shots for the general public. We will have more clarity once the federal government provides us guidance. In addition, I want to provide a brief update on opening additional capacity in mental health beds. At the Brattleboro Retreat, they plan to have 65 beds available by September 20th. They have had 47 beds available for some time now, and they are currently at 54 beds. From there, the goal is to increase overall hospital capacity to 75 beds by October 1st. That will include a target of opening 6 Linden Lodge beds. These are new beds that will be open. As for the Vermont Psychiatric Care Hospital in Berlin, since mid-July, we have onboarded 13 registered nurses, including 5 who started today. It's our hope to have 9 beds open as soon as possible. Turning to vaccination rates, as you've heard, as of today, 87% of eligible Vermonters have received at least 1 dose of the vaccine. That means 77.8% of all eligible Vermonters are fully vaccinated. You can walk in and get vaccinated at most local pharmacies. You can also visit pharmacy locations at the community health centers of Burlington, Northwestern Medical Center, and the Southwestern Vermont Medical Center. In addition, we will be sending out a press release detailing the 23 school-based clinics and pop-ups available this week. Again, I do want to note that in the coming weeks, these pop-ups will be scaled back as larger clinic sites are reintroduced for vaccines and boosters. You can find information about these pop-up sites at healthvermont.gov/myvaccine. Lastly, I want to just briefly add on to what the governor said about suicide prevention. Over the past several years, state agencies and departments have been working closely with community partners to expand and improve the services and supports they can help to prevent suicide. Suicide is not just a mental health issue. It is also a public health issue. Vermont took an important step in acknowledging this fact when we chose reducing suicide deaths as a public health measure for monitoring how well we are doing at implementing our health care reform goals. The cause of suicide is complex and requires a multi-pronged approach to make an impact. I am encouraged by the work of the Mental Health Integration Council as they implement strategies to integrate mental health into the healthcare system so every Vermonter is supported by the right level and type of care at the right time. I especially want to thank the leadership of Commissioner Haas and Deputy Commissioner Cruff at the Department of Mental Health for providing the support that they have done. As I and the Governor have noted, the pandemic has created a host of difficult challenges for Vermonters who may be at risk, as well as for our ability to provide critical services in this era. It's been a challenging time, and I think Vermont has stepped up and continues to step up during this time. I'll now turn it over to the Deputy Commissioner.
Thank you, Secretary. The Secretary and the Governor have mentioned the incredible work done by our mental health and healthcare workforce in supporting tens of thousands across the state. I would like to take a moment and say thank you to the dedicated clinicians and support staff who've continued to deliver mental health support to individuals throughout the pandemic, all while they manage their own pandemic-related stressors, their own mental health, and that of their families. I encourage them all to take a breath when they can and to make sure they're caring for themselves throughout this work. The COVID-19 pandemic has made care delivery all the more complex, but our ability as neighbors and peers to care for each other has shown through as a strong and enduring force, a testament to the unique way we as Vermonters can be there for one another through the good as well as these more challenging times. During my time in Vermont as a suicide prevention coordinator, I've spoken to so many people in the state who've been touched by suicide. And as a clinician, I've sat with individuals contemplating suicide themselves. It is so important that their stories and the stories of others with lived experience continue to shape the way we approach suicide prevention in Vermont. As Secretary Smith mentioned, suicide is not just a mental health issue. The Department of Mental Health is grateful for the partnership of the Department of Health, who's helping us approach suicide prevention from a more holistic population health lens. While September is an opportunity to raise awareness around suicide prevention and promote mental health awareness, we all have a role every day to address this important issue, impacting our communities and our families. Reaching out, staying connected, and checking in with one another, all of these are ways that we can help alleviate the burdens often felt by those experiencing suicidal ideation. And when you reach out to check in on others, it actually improves your own mental health as well. Here are a few other things each of us can do to prevent suicide. Take time to learn about the signs of suicide risk and what you can do. Resources like #BeTheOne2 provide simple guidelines for supporting others who are struggling. You can visit the Vermont Suicide Prevention Center's website, vtsbc.org, and there you can find custom local resources and events. Support your own mental health. Take time to check in with yourself. Ask how you're feeling. Staying in touch with your emotions can help improve your mood and lower your anxiety. Practice self-care to help you cope with everyday stress and prepare yourself for stressful situations. Learning how to manage stress in healthy ways can make you and the people you care about, as well as your community, stronger. If you know someone who is struggling, please reach out. If you are struggling, talk about it. You can reach out to resources that are available 24/7, such as the Suicide Prevention Lifeline, the COVID Support Lifeline, or if you'd rather text, we have a 24/7 crisis text line. You can reach that by texting the letters VT to 741-741. For the Suicide Prevention Lifeline number, that number is 1-800-273-TALK, and it is now being staffed 24/7 by local Vermont mental health workers to support our state's callers. It is also free and confidential. Throughout September, we'll be shining a light on the resources that are available for people who are struggling, as we also continue to expand our suicide prevention efforts with upstream programming and shaping a more integrated approach to both mental health and wellness. By addressing the stigma around asking for help, improving our care systems, and listening without judgment, we as Vermonters can come together to build resiliency and support one another. Lastly, as the governor mentioned, we encourage all residents to take the time to inquire as to the well-being of their families, friends, and neighbors over the next few days, and to genuinely convey their appreciation for each other in any way that they deem appropriate. A simple phone call, a message, can go a long way towards helping someone realize that suicide is not the answer. Thank you.
Good afternoon. I'm going to start off with a recent morbidity and mortality weekly report released by the CDC on Friday. It monitored the incidence of COVID-19 cases, hospitalizations, and deaths by vaccination status this spring and summer when the Delta variant became predominant. The report found that people who were not fully vaccinated were more than 10 times more likely to be hospitalized and 11 times more likely to die of COVID-19 than those who were fully vaccinated. These are the major outcomes we always look at with vaccines. And while the reduction in risk for infection was less dramatic, it was still highly impressive, showing that people who are unvaccinated were 5 times more likely to have an infection than those who were fully vaccinated. This real-world data suggests high and continued vaccine effectiveness against severe COVID-19, including the Delta variant. This is why getting vaccinated is still the most important way to protect ourselves against the virus, and why our rate of 77.5% of eligible Vermonters who are fully vaccinated still matters so much, even in the face of this highly contagious variant. However, the Delta variant has greatly driven up COVID transmissions around the country, including here in Vermont. As we've noted before, the ability of this strain of the virus to jump from person to person is significantly greater than the original strain, which touched off the pandemic in such a short time. This is why we must all think once again about the choices we make as we go about our lives right now. We need to consider the risks once again of large gatherings, crowded places, where and how we travel. Fortunately, we still have tools and knowledge for slowing the spread. Wearing masks indoors, getting tested, getting vaccinated, and staying home if you're sick. The more we all use these prevention tools and make smart choices to avoid risky activities right now, the more we can protect our communities, which includes workplaces, long-term care facilities, child care facilities, and schools. We have seen and will continue to see cases in schools because many children can't be vaccinated right now. But we know going to school is still critical for children's learning and social and emotional well-being. So, though many parents and caregivers are already likely taking more precautions, and I thank you, I'd like to remind everyone that even if you don't have children, or someone else in your life who may be vulnerable to the virus, you can still help by giving the virus fewer chances to spread during this Delta surge. You can also help us move more quickly against this new variant by knowing what to do if you do test positive or are in close contact with someone who does. Here it is. If you have COVID, isolate yourself right away and reach out to your close contacts. If you're a close contact, get tested and quarantine as appropriate. Don't give the virus another way out. You can continue to find the information you need at healthvermont.gov/COVID-19. Speaking of children, pediatric cases are in the news and on our minds, and I'd like to say a few words about them. Frankly, there are frightening reports from other parts of the country of cases and hospitalizations. 2 other CDC morbidity and mortality weekly reports published last week looked at illness in children since the Delta variant arrived. And these reports provide additional lessons about vaccines. First, COVID-associated hospitalizations since Delta rose nearly 5-fold among children and adolescents, with hospitalization rates 10 times higher among vaccinated than unvaccinated adolescents across the 14 states involved in the study. In the second report, an analysis looking at children ages 17 and younger, COVID-related emergency department visits and hospitalizations were found to be about 3.5 times more frequent in states with the lowest percentage of the population vaccinated compared to states like Vermont, with the highest vaccination rates. This again shows the power of community vaccination and other prevention measures in protecting our children. According to the American Academy of Pediatrics, of all the states, Vermont has the 3rd lowest rate of COVID cases among children. But 3rd lowest is not none. We've had 5 pediatric COVID hospitalizations this year, with 1 currently hospitalized, all since Delta arrived. And we see clear difference in COVID in Vermont pediatric case rates when comparing those eligible for vaccination with those not eligible. If you look at the gold line, that is the oldest age children, 12 to 18, who are all eligible for vaccination. You see that nicely flattening out at a rate of 16.1 per 100,000. When you look at the children who are either ages 6 to 11 or 0 to 5, you see the rates are almost twice as high. These children are, of course, not yet eligible for vaccination, but we hope that will occur into the fall. This is yet another example of the power of vaccination and its impact on our pediatric population. So once again, vaccination is still our strongest and most protective defense against COVID-19 right now, even protective for those who have not yet or cannot yet receive vaccine. I'd like to also briefly address the health department's reporting of daily case numbers. We're glad that the data has been so informative and useful, and I want to thank our data teams whose behind-the-scenes efforts are simply above and beyond. It's an important point to know that our infectious disease surveillance data is reported as provisional and subject to change. In fact, that statement is on the health department's reportable disease data webpage. It applies to pretty much every piece of data we report. In a real-time, fast-paced pandemic, we are always balancing the need to provide data quickly with the work that has to be done to make sure it is complete and accurate. COVID-19 data is reported as completely as we know it to be on any given day, and it is updated as new information is learned and reviewed. In recent weeks, like earlier in the pandemic, large numbers of cases have been added to the prior day's case count as lab reports from the prior day are investigated. We're working, as you heard from Secretary Smith, to reduce that number and have implemented some changes in our processes, but it does not affect our ability or the public's ability to see and analyze the data once it is complete. I also want to update you on where we are with booster shot planning. Very simply, a CDC advisory group is meeting on Friday to discuss data related to boosters, and we will keep you updated as soon as we have more information to share. While I feel somewhat confident about the fact that patients in nursing home facilities will be prioritized and have boosters, I cannot be confident of anything beyond that at this time. On a final note, I'd like to bring attention to a project the health department's working on with the University of Vermont to better understand the current health status of people who have tested positive for COVID-19. We are reaching out to Vermonters as part of this project, and the effort will help the state's healthcare system respond and adapt to the effects of COVID-19 on the health of Vermonters. About 2,500 people have been randomly selected to participate. So if you had COVID-19 in the past 6 months, you may get a call or an email from the university. If you're contacted, please answer the phone and return the call or reply to the email. Your help will be greatly appreciated, and any information you give will be kept confidential.